paradise, right?
This is paradise. I don't know what to say.
Where normally horses are running around shitting.
Huh?
Where normally horses are running around shitting.
Ah!
So, hey, you guys, so what's going to happen, everyone should come in a few minutes. We're going to do a walkthrough of the site with the Cobb Public Health Post. They need y'all to hang out here. You're going to see everything that's going on. He's going to walk up there, go and see a tent, come back, and then take questions, or just comments. Dr. Toomey will take some questions. We need y'all to hang here while he's doing that, if that's okay. Cool? Good up. I'm good, man.
is Dr. Memark.
Hey, Dr. Memark. Hey, good to see you. Nice to meet you. Thanks for all you're doing.
No worries.
Hey, congratulations.
Thank you. Mayor, Mayor Toomey.
From the fire hose.
I bet. Hey, man, good to see you. I'm doing good.
Good to see you.
Great. Morning, everybody.
Thanks for
Appreciate all you guys are doing.
Thank you. We're grateful for our public health team. They've done a fantastic job. Appreciate our support.
Well, thank you. I'm trying to get all the
How you doing?
contracts here to catch up. A few weeks to get my feet on the ground. I know how that transition. Sure, it's that time. Look forward to working with you. Mayor, everything good in Marietta?
Yes, sir. We're hanging in there pretty good.
Right.
So I'm going to introduce you to the Deputy Director, Dennis Baird. He'll start the tour. And Catherine's behind the director. Are you ready to get a tour and see? Dennis will help to lead our tour for us, and then
Just
we'll show
glad we
you.
came today, not yesterday. Yeah.
That's a good way to look at it.
Hey everyone, can you guys let me know whose mics these are? We're going to need to move them around a little bit just so we can fit remarks on the podium. I just don't want to, mainly these two right here, I just don't want to mess with anybody's stuff. Is it yours? This one? That's what I was going to do, yep. Yes.
Pam Valley.
Hey, it's good to meet you.
Good to see you. Just
All
wanted to say hi. I know you're.
Yes, ma'am. No, I'm good. I'm just trying to make sure the boss doesn't get mad at me. So we will circle back around. Thank you. Hey, Aaron, do you guys want to look at me? Pretty quick.
play soothing music for me?
Yeah, hopefully.
Okay.
Thank you so much.
Okay, great. Good morning, everybody, and thanks for coming out in this chilly weather to join us at Jim Miller Park. I'm Dr. Janet Memark. I'm the District Health Director for Cobb and Douglas County, and I'm here to welcome everybody. So, we've started our second year into this pandemic, and, we can look back and we can, reflect on our county alone had 51,000 cases of COVID, and we've unfortunately lost 750 lives. We've had an incredible number of hospitalizations throughout and have stretched our healthcare systems, but really has shown the dedication of our healthcare workers throughout this pandemic. I know, when we look back, we're going to try to forget our school days at home and missed celebrations and the holidays away from our loved ones. But as we look at all of this, we still have a lot of fighting to do for COVID-19. And so even in our district here in our county, we have to battle the variant is our next battle that we have to go up against. So even with these challenges that we are facing and have faced and are looking forward to facing, we still have a lot of hope right now. And so that hope comes with this vaccination, with the COVID vaccination. And so we're really hoping and praying that it's going to help to give us a lot of protection against this pandemic so that we can protect those that can't protect themselves. I want to thank our healthcare workers, especially that have been on the front line and continue to be on the front line against this pandemic and taking care of our citizens. And I want to thank our public health workers as well that also have been here, and they've been out here in the rain and the sleet, and when it's 100 degrees and when it's bitterly cold like today. Thank you to Cobb County and our chairwoman who have given us this space throughout this pandemic and resources and help. We've started the pandemic here doing COVID testing, and we hope to end it here with COVID vaccines. I want to thank Dr. Toomey and DPH for helping us navigate the twists and turns of this pandemic. And finally, we want to thank Governor Kemp for his leadership throughout this pandemic, and I know it's not been easy on any of us, but we appreciate you and coming out to visit us here at Jim Miller. I know we've had our ups and downs getting people here to get vaccinated, but once they get here, they're very happy and they get their vaccinations, and we hope that we're here when we end this pandemic here as well. So thanks everybody for coming, and thank you for Governor Kemp and Dr. Toomey for coming today.
Well, good morning, everyone, and thank you, Dr. Memark, for those remarks, and just thank you for all that you're doing, the incredible work that you and your team have been doing, not just recently with the vaccine, but over the last 11 months serving Cobb and Douglas counties. We're very appreciative of that on many things that you have done from a public health perspective. I want to thank Mayor Tumlin, Chairwoman Cupid, the EMA folks that are here, public health. We've got the Georgia National Guard on duty helping with the response as well on this great operation. And also very well aware that it's cold this morning, so I'll be very brief. I just wanted to give you a quick update on things as they are as of today. Our providers across the state have administered 1 million COVID-19 doses in the state of Georgia. Additionally, we believe that tonight we'll also have crossed over the 500,000 seniors who will have received their first shot. These are certainly two big encouraging milestones against our fight against COVID-19, but we know that we cannot rest on our laurels. We are certainly on the right path to getting Georgians back to normal, and the hard work of our public health workers and many other people here at Jim Miller Park and across the state are on the front lines of making that happen every day, and we could not be more grateful for them. But as I've said before, this is about moving the needle every day in regards to this global pandemic. And while we have administered over 1 million vaccinations as of today, as a reminder, we have over 2 million Georgians who are currently in the phase 1A plus criteria. The 500,000 seniors that have received their first shot We've also got to ensure that those Georgians get back for their second dose and then continue making headway on the 1.3 million seniors that we have left to get those vaccinated as quickly as possible. I'll also reiterate again that Georgia's vaccine supply continues to not meet the demand that we have out in the community. So it is our demand is drastically outpacing the supply that we're seeing in our state. As you may have seen yesterday, the Biden administration announced that 1 million doses will be allocated to pharmacies across the country. And while we do not know exactly how many of those will end up in individual pharmacies in the Peach State, we know for one thing, it's not going to change our overall supply shortage. We're glad to have it, but we realize that that is, going to be insignificant from the incredible demand that we have out there, but very grateful for those additional doses that are coming across the country. Given this slight increase, the state's allocation will bump up to about 154,000 doses per week starting with next week's shipment. And I will just remind everyone that additional doses announced yesterday is going straight to those pharmacies, so the state doesn't have a role in that. Other than that will be part of the overall allotment. Again, any additional vaccines are certainly welcome news, but we realize this will not significantly impact our overall lack of supply when it comes to meeting those demands. Given the ongoing supply-demand issue we have experienced since December, we've also seen public health districts across Metro Atlanta, like the one we are visiting here today, take short pauses in scheduling new first dose appointments. Again, this is simply due to a supply issue of the vaccine doses. My message to everyone hoping for current vaccine eligibility to be expanded to more Georgians remains the same. Dr. Toomey and I hear you, and trust me, we will want nothing more than to expand the criteria, but our current supply simply does not make that feasible at this time, but it is high on our radar. I can assure you that once we reach that point or feel comfortable providing when that is possible, I commit to you that you will hear from Dr. Toomey and I very quickly to inform the public and start getting more Georgians vaccinated. I'll finish today by providing a quick update on our COVID-19 data. We continue to show promising trend lines. Our 7-day moving average of new cases has declined 46% from our peak on January the 11th and is now passed below 4,000 cases daily. Our percent positive has declined from 18.1% a month ago to 13.7% today. Here in Cobb County, the 2-week average is actually a little bit lower than that at 12.4%. And really good news, our current hospitalizations are more than 1,700 patients lower statewide than our peak on January the 12th. I will say though, as much as these are encouraging trends, these numbers are still high, too high for many Georgians to let their guard down and stop following the public health guidance. Wearing a mask, practicing social distancing, washing your hands, and following the lead of public health officials like Dr. Toomey, Dr. Memark, and many others that has proven to work in limiting the spread of COVID-19, especially in light of the new variants that we are certainly dealing with now. The vaccine is here. We're getting more shots in arms every day, but we are also still in a deadly race against a highly contagious virus. I mentioned the new strains that are spreading quickly in places like Brazil and others, and we know that those variants, we have to assume that they're here. We need to stay on guard in regards to that. This virus is killing too many of our fellow Georgians, too many of our neighbors, and too many of our friends. It is up to all of us to remain steadfast in our commitment to our fellow Georgians. We can do this, we can get through this, and we will get back to normal. But by doing the right thing, choosing to be part of the solution and not part of the problem, we can finally get to the light at the end of this long, dark tunnel that this state, this country, and the world has faced. And with that, I'll turn it over to Dr. Toomey.
Thank you, Governor. Thanks so much. And just very quickly, a couple of highlights, but most of all, I want to thank Dr. Memark for her invitation here today, Chairwoman Cupid, Mayor, for your hosting us here and allowing us to see this tremendous operation. What you're seeing here is just exemplary, but also exemplary of what is happening throughout the state. Many of our public health districts have set up similar sites, and like you heard today, are capable of doing many more vaccines daily when that supply is available. And so we look forward to that day that we can even ramp up. But the efficiency of this operation and the cooperation you see between the county and the EMA and the Department of Public Health, as well as the health district, I think it just shows you how powerful this can be when we all work together to make this happen. As the governor said, these variants are of concern, but I want to make sure that everyone understands that these variants, it doesn't mean that they're not everywhere. We have a kind of a limited surveillance system for them at the current time. We've been seeing these variants largely from CVS sites because that's who is sending them to be tested. We have relatively little other variants being tested, and actually the ability to test this genetic makeup actually takes a week. So there's a delay in getting that information back. But recognizing that, as we're seeing, there's many more, 23 today at last count, and likely to be additional ones identified. To me, that means that you don't have to avoid Cobb or avoid other counties that may have had these variants. It means these variants are widespread, probably throughout Georgia. And so it just reinforces those prevention messages that the governor has repeated so many times, and that we have to continue to heed that message. To wear your mask, social distance, continue to follow these prevention guidelines, which will help us even as we do the very intensive contact tracing that will be required of us around these variants to try to identify and understand better how they're spreading throughout our communities. And the last thing I wanted to say is I know there's a lot of interest and concern about ensuring that we have equal access for everyone to vaccine, regardless of your race, your ethnicity, where you live. And we are working hard to ensure that we have every available opportunity to do special outreach clinics, to do other kind of information education. We're developing a special communication campaign specifically to try to ensure that all communities fully understand the value of this vaccine and how to receive the vaccine, even as we put together special mobile units in many of our districts to be able to reach some harder to reach communities. I'm also hoping that as early as next week, we will have up on our website a special dashboard that will have all the metrics from our vaccination program statewide, including race ethnicity data, which I know is something of concern. We are encouraging all providers to include that data. You know, we, as always, even as it was with testing, we're dependent on the providers who do the tests, whether it be public health or our many, many community partners, hospitals, as well as private sector providers, to complete that information. So we're working hard to ensure that that is complete on every vaccine administered. But we will be looking at that and monitoring that and identifying those communities with special needs, and we will be working on that even as we continue these large sites. And so I just wanted to say once more, I'm very proud of the work being done here in Cobb, and I just want to thank Dr. Memark and all her team for the extraordinary work, 24/7 literally, to be able to make this happen. And thanks to all of public health for the work that they're doing statewide. to keep the state healthy. And thank you so much for being here today.
Oh, we got any questions?
So this is a question probably for Dr. Toomey, if you don't mind. So it looks like state officials are considering money in the budget for a vaccine appointment booking system. What else can you tell us about that system? Apparently this is an off-the-shelf thing DPH can get set up quickly. Can you tell us details about it? It's made, how quickly that might be set up?
I mean, the vaccine booking system is actually not in the budget. That is already paid for. We've been working on it. It's actually identical to the vaccine booking system we use in many of our testing sites. It's Microsoft Dynamics. It's a Microsoft product. Many of our districts have that up already, and we'll be enhancing that now for the vaccine scheduling. So we're hoping to roll that out by mid-February, so a couple weeks, less than a couple weeks, probably incrementally, so it doesn't get overwhelmed on the first day we put it up, and we'll be rolling it out from district to district throughout the state. But it's the same scheduling system that we use for the testing now modified, and that's not in the budget. That's already in the works.
Was there not an $18 million ask in the House budget for booking? Just to be clear.
Yeah, so just to be clear, the House did put that in. That budget has not passed the Senate yet. Obviously, it hasn't been agreed to by both bodies, which is part of the process. Then it has to be signed by myself after we do the due diligence. So that is not something that's going to happen in the near term. What Dr. Toomey's focused on and what our team is focused on is our existing systems, enhancing, adding to, doing additional scheduling so we can do more and more every day as the vaccine supply ramps up, whether it's 2 weeks from now or 2 months from now, that we'll have a more streamlined process to be able to do that. What I think the legislature is working on is just the overall system from a technology standpoint. We appreciate their willingness to support public health. We're in discussions on what that looks like to make sure that we're putting money where it needs to go into systems that it needs to go, and that's part of the legislative process. So that due diligence is ongoing.
Sandra?
So, and Dr. Toomey and Governor Kemp, I know we're talking about mass vaccination sites. Is it kind of in the future? I'm wondering, is this what you envisioned and what you thought of it since you've been here?
Well, I can certainly let Dr. Toomey talk about that. I will tell you that this site is very impressive. I mean, you can sit there and look, and you can envision, and we're working on this as well. I had a briefing yesterday with Director Stallings at the Georgia Emergency Management Agency and our team on mass vaccination sites that we are, as I mentioned over a week ago, 10 days ago, the state is preparing for. We do not have the supply to do that right now. I think for people at home to realize what we're dealing with, if we had more supply right now, that lane that's empty could be full of cars, but it's not because we just don't have the vaccine. So you can see how efficient this operation is, how smoothly it's going, and in our tour today, it was made very cognizant to us, and I heard the same thing yesterday, that you can, if you get the supply, you just add another lane. With the existing infrastructure that you have, maybe take a few more people, but the concept is exactly the same, and that's what the state's preparing for. We're basically figuring out how to do this per lane, and if we get X many of doses, it'll take 2 lanes. If we get twice that much, we'll have 4 lanes. So that's kind of what we're looking at, and it's just going to depend on how many locations we can have where across the state based on the supply. I mean, the good thing is, if 2 weeks from now they said, we're going to get another 50,000 doses a week, we've got facilities already up like this where we could immediately transition those doses to facilities like this. I know they did something similar in Dalton, and they've done it other places. I was on the phone last night and this morning with folks in Augusta that are working on a similar approach, and then the state is working on those as well. And then we know that the Biden administration has talked about federal sites. And I don't know if they're going to do that or not. I've heard some hedging on that because I think the states and the governors that I heard yesterday on our call with the task force at the White House, they're very confident about being able to do more if they had more supply. And everybody's in the same boat. And that's why we continue to ask for patience. We continue to ask people to follow the public health guidance, social distancing, wearing a mask, and continue to support these fine people that are here today and all across the state that are doing all they can with what they got. Yeah, so I think the 154,000 doses that we'll be getting now, our new allotment, we're pretty confident that that's going to be stable for, I believe, the next 2 weeks or 3 weeks. So we know nothing's going to change over the next 3 weeks other than just moving from 146 to 154, whatever the number is.
Sorry, this is a question regarding the new variants here that are coming into Georgia and businesses. There are pictures circling online of bars open with people not wearing masks, packed, no social distancing. Has the state thought about ways of stepping in and holding those businesses accountable for what they're doing?
Well, look, the local authorities can do that now. You know, in the executive orders that we've had going way back to the summer, they have the ability to go in and enforce the regulations that we have for all kinds of establishments, including occupancy and bars and other measures that we have in there. So they have that ability to do that now. There's just a lot of people that aren't focusing on that. I've had discussions with other local leaders about that. So I would encourage them to get their local police departments to educate those bar owners. I know when we were having problems early on, we simply went to downtown development councils and asked that they get the guidelines out to those places, and we let them know with a courtesy visit saying, hey, we're going to be enforcing these. I believe if the locals do that, people will do the right thing, and we can continue moving on.
Well, question to Dr. Toomey. We've been asking the governor about, different groups that want to be getting vaccines, specifically teachers. Once you get through more of 1A+, is there a possibility before moving to 1B just to add more people to 1A+, like teachers? Would that be a possible approach to vaccinating teachers?
I mean, let me just say it. I'll let the governor respond too. I think there's somehow the misinterpretation that if someone isn't in a group, that we don't value them or we don't think it's important to have them vaccinated. We want everybody vaccinated. I mean, I would love it if we had enough vaccine to vaccinate and open up. And as you see, we can get many, many more thousands of people daily into these sites, even as we're working with outreach teams to reach homebound individuals and others. So this is all going on in a coordinated effort. I think the problem is always going to be adequacy of vaccine and ensuring a risk-based approach. Who are those the most likely to be adversely affected by COVID? And if you look at our numbers, it's these older adults that are more likely to die or have severe deadly complications. So I think taking that risk-based approach, the governor and his team and our public health team will look at the data and see what makes sense as the next step. But I mean, obviously we want teachers who are critical to all of our communities, as well as many other individuals at risk, to be vaccinated as soon as we can. Do you want to say something, Governor?
Yeah. And I'll just add to that too. I would remind the media that 3 or 4 weeks ago, when we were at our peak for COVID hospitalizations across the state, everybody's asking me the question, are you going to shut things down again? Are we going to have enough hospital beds? And that was our focus. And that's the reason that the CDC came out with the early guidance, obviously of protecting these folks that are behind us on the front lines, that are giving vaccines, that we're doing testing, that are treating people, our medical workers, nurses, public health workers, first responders that have no choice. They have no choice but to respond if there's a fire, a shooting, or what have you. But the other criteria is the age. We know that the older somebody is, the more susceptible they are to being hospitalized or succumbing to this deadly virus. And that is why we are focused on them, is to help our folks out in the hospitals that have been working tirelessly, just like our public health workers are. So these decisions are based on data. I'm like Dr. Toomey. I wish we could add teachers right now. I have grocery store clerks that are on the front lines, front-facing people every day, many other clerks and all kind of different businesses, and restaurant workers. I mean, you can make the case for a lot of different people that should be included in the next phase, and we want to do them all. But right now, the best public health response with the supply that we have is to protect the people that are the most vulnerable, and that is what we are doing. Everyone else, I would urge you to continue to be patient and follow the guidance that we have been putting out for many months.
Yeah, so we just signed the papers recently at a site in Douglas County. It'll be a little bit different. It's going to be in a more parking spot in a mall, that has some abandoned spots over there. So we'll be doing it over there, and in the next few weeks everything is being ordered and on the way, and we're waiting for vaccines to come, and so we're going to shift our operations from the Douglas Health Department to the larger site, and they should be able to do as many as we can do here as well, and so offer more vaccines to those citizens as well.
One more.
We're looking at the next few weeks. So they're setting up slowly right now in the next few weeks, and hopefully it will coincide with the arrival of vaccines for us as well. Yes, sir. Yeah.
Are there any folks who might not be vaccinated the second time we did the 3-4 week window? Is there any risk of that happening?
No, I mean, we're prioritizing those second doses, and so this is a great time to let everybody know that, for the Pfizer vaccine, you can get vaccinated the 21 days and Moderna 28, but you do have up to 42 days to get that vaccination. And so, excuse me, the cold makes my nose drip. We are prioritizing the second doses. We're sending emails and phone calls, and so everybody should get vaccinated. If you don't receive a notice, please email us, and we'll make sure you get your appointment.
Dr. Mimar, this is a pretty basic question, but we've had a lot of readers who contact us pretty desperate in their 70s and 80s who have not even been able to get through to get a vaccination schedule, first vaccination. What would you tell somebody like that directly if you were talking to them right here?
Well, for our county, okay. For our county, right now the vaccine supply is very low, but be patient and just keep trying. And so there are other sites, not just ours, but the DPH vaccine locator. You can actually find different sites throughout the county and district that can get you some vaccine. I am worried about the folks that are not as internet literate, and so we are working with the county to come up with a call center that can help those folks. And then we're also going to do some outreach too, to go out to communities that need a little bit more assistance. We have those in the plans as well. So soon we should have vaccine coming our way. And Dr. Toomey?
I'm so glad you asked that question, because this is what I lose sleep over at night about, because I worry about those who aren't able to navigate the internet and able to manage what seems to be an impossible scheduling process. We've actually put together a team to develop plans that we will be sharing with public health statewide, working with the AAAs, the aging agencies, as well as the Department of Human Services, who will have social workers available to actually help individuals get scheduled at sites. And likewise, where many of our health districts are able to redeploy some of their mobile vans that were used for other outreach efforts, including for testing in the community, to also do now vaccinations going into particularly hard to reach areas. So I think I'm worried about the elderly as well as communities of color throughout the state who may have some hesitation. And so I think working with the AAAs, working with our colleagues in the Department of Human Services and the aging agencies, We have now a plan. We'll be sharing it with the health directors later this afternoon. And I'm looking forward to being able to reach out to them proactively, these individuals. Even my own colleagues or my own peers said to me, I was told to register in a portal, but I don't know what a portal is. And so they're, you know, that's not an 86-year-old, that's a 70-year-old. So I think just knowing that, we realized we had to make an extra effort and really mobilize all the resources we have in the state and local area to help. And so we will have a comprehensive approach to be able to address those issues. And thank you for letting me talk about something that's very important to me.
Great way to end it. Thanks, guys.
Concerns about the Super Bowl? Super Bowl gathering?
Everybody follows the guidelines. There could be an